Are you plagued with heartburn? Do you avoid eating some of your favorite foods for fear of the discomfort of heartburn? Do you constantly eat Tums? If so, you may need an H2 blocker. H2 blockers are the most popular drugs used to treat GERD and peptic ulcer disease. They work by decreasing the production of hydrochloric acid in the stomach and therefore increasing pH. They are extremely efficient and safe and are all available over the counter. Some of the most common drugs used are Tagamet, Zantac, Axid, and Pepcid.
Here, Ricky, try some Tums. It might seriously help.
Thanks, Aaron.
You're welcome.
Wow, now I feel much better.
Tagamet was the first H2 blocker to be released on the market. It was also the first major prescription drug to be released over the counter. It is used to treat dyspepsia, ulcers, and GERD. However, Tagamet was the potential to cause drug interactions, especially in the elderly. Talk to your physician first to determine if Tagamet is right for you. The usual dose is 200 milligrams orally twice a day.
Zantac was the second H2 blocker to release on the market. It's a very widely used drug, and Zantac carries less of a chance for drug interactions. It can be taken orally with a dose of 150 milligrams once or twice a day. Zantac is also used for dyspepsia, ulcers, and GERD, as well as treatment of erosive esophagitis.
Axid is mostly used to treat ulcers in the stomach and intestines. Axid is also taken orally, and treatment may continue for up to 12 weeks. Although symptoms usually improve after just 4 weeks, Axid can cause side effects that impair your thinking and reactions. Take caution when driving or operating heavy machinery until you know how Axid affects you.
Pepcid was the last H2 blocker to be released on the market. Unlike Tagamet and Zantac, Pepcid carries no risk for drug interaction. The usual adult dose is 10 milligrams taken orally once or twice a day. As with all H2 blockers, alcohol and smoking should be avoided. For optimal treatment of dyspepsia, ulcers, and GERD, H2 blockers should be taken 1 to 2 hours before an antacid. Oral and IV forms are also available for all of the drugs mentioned in this ad. Your doctor will determine which course of treatment is right for you.
Please remember to consult your physician before using these drugs, as they may inhibit the absorption of other drugs that require the acidity of the stomach to be absorbed. Smoking may decrease the effectiveness of H2 blockers. Tell your doctor about any allergies you may have, or if you have impaired liver or renal function.
Known side effects, although uncommon, include hypotension, headache, lethargy, confusion, depression, slurred speech, agitation, increased prolactin secretion, diarrhea, nausea, abdominal cramps, impotency, increased blood nitrogen, and just a whole bunch of other stuff.
Zantac was the second H2 blocker to be released on the market. It's a widely used drug, and Zantac also has less of a chance of drug interactions. It can be taken orally with a dose of 150 milligrams once or twice a day. Zantac is also used to treat ulcers and GERD, as well as treatment of erosive gut.
Axid is mostly common.
Pepcid was the last H2 blocker to be released on the market. Unlike Tagamet and Zantac, Pepcid carries no risk for drug interaction. The usual adult dose is 10 milligrams taken orally once or twice a day. As with all H2 blockers, alcohol and smoking should be avoided. For optimal treatment of dyspepsia.
Are you plagued with heartburn? Do you avoid eating some of your favorite foods for fear?
What are you doing?
Trying to mess you up. That's fun.
Jump on it. Jump on it.
I ain't jumping on.